Testing 1 2 3. Testing 1 2 3.
Back, right? Good afternoon, everyone. We're going to begin our Reentry Network meeting. And just instead of having roll call, John, do you mind? We're just going to all introduce ourselves, and it's also a way to make sure everybody knows how to use the mics. So we're going to start with you.
John Mills, Employee Services Agency Director.
Good afternoon, Molly O'Neill, Public Defender.
Sarah Cody, Health Officer, Public Health.
David Angel, District Attorney.
Aaron Johnson, Director of Pretrial Services.
Judge Vanessa Zecker, Supervising Judge, Criminal Division.
Stephen Manley, Superior Court.
Troy Bellevue, Sheriff's Office.
Lori Smith, Sheriff's Office.
Mary Crocker Cook, Behavioral Health.
Cindy Chavez, Board of Supervisors.
Miguel Marquez, Chief Operating Officer.
Pablo Gaxiola, former inmate and current program manager for the NOW program at Goodwill of Silicon Valley.
Keeley, County Office of Supportive Housing.
Amy Lay, Sheriff's Office.
Christine Clifford, Pacton, Silicon Valley Debug.
Erin O'Brien, VHCA Community Solutions.
Hi, Laura Garnett, Chief Probation Officer.
Cora Tomalinas, Community Member.
Kishan Vajini, South Bay Consortium for Adult Education and San Jose Evergreen Community College District Educational Representative, first time here.
Mike Sellers, Santa Clara Police Department.
Is there any other committee members that are here? Matt, are you on the committee? Why are you, did you get in trouble? Why are you out there? There's a seat right here. Matt, no pressure. Come to the front. Is there anybody else who's on the committee that should be sitting up here? All right. Thank you. All right. So what we're going to do is I'm going to thank everyone for the roll call, and we have a quorum. And so we're going to go to public comment, and this is for anybody to speak to an item that is within the purview of this committee that is not on our agenda today. And we have one speaker for public comment, and that is Scott Largent. Sorry about that. Didn't mean to leave you out there.
Thank you. Oh,
sorry about that. Good afternoon, everybody. Scott Largent. I kind of lost track of what I was going to talk about. That normally doesn't happen, but I received a text message. I was referred to the, it's the Bay Area Legal Aid Society. And it was a reference, I had asked the Public Defender's Office about some of the issues I was having. And the same thing happened like what was happening with the Law Foundation. They basically took my mental health issues and thought it was appropriate to pimp out my information to do these surveys. And, you know, I never authorized any of these people to take my information. And I find it very strange. Like I've said before, I don't want a $40 gift card at Walmart. I really don't need that. And I don't know why I keep getting these. So any type of reference to the county or the courts, that's what they do with my information. And it's just unacceptable. I really just think this is wrong. So if anybody's paying attention to that, maybe we can stop doing that in our county. I've been talking to a lot of people about, you know, stuff that's been on the news lately about dividing families of immigrants. And I think that's a bad thing to have happen, but we need to realize what's happening here in Santa Clara County when we're dividing our own families down here. In my situation, which is similar to a lot of different people, I pay hundreds of dollars an hour to see my child. These are all the different receipts I have. I guess I should be happy that I'm able to see my daughter now. I can't afford any of this stuff. Any of the other services through our county only offered 1 hour. So an indigent client gets 1 hour a week at our courthouse to see their kid. Something needs to change about that. We need to, you know, get these families back together. And I go into a complex over here off of Coleman, and I've got to pull into a parking lot, and then I pull into the back corner. I've got to text these visitation provider people. I've got to wait, you know, in the car. My ex has to pull in the other side, and we go through this process that we do every week. I don't have a stay-away order. I don't have a criminal record. I mean, there's all these things that the system wants to continue to keep us apart. Now, I'm not wanting to go run and get back together with my ex. She hasn't talked to me in a year and a half. We have a child together. We have to learn how to co-parent together. Now, why are the courts not requiring people to do that? They never followed up. This mediation was a joke. All the other stuff I did for the court system was a joke. And I'm just surprised they don't do the right things to unify families together. I need to learn skills to co-parent with my ex, not all this other junk. And this is extremely frustrating. And then on Monday, I get to waste more time because I'm being prosecuted over protesting. So remember that. I'm being prosecuted over protesting. I've already been through 2 jury trials for protesting the police department. Because I spoke up at these meetings, I had welfare checks done on my grandmother. All this for my First Amendment right. That's what happens in Santa Clara County. That's unacceptable here in the United States of America. Thank you, Supervisor Chavez.
So we're going to move on then to our agenda item. I have no other comments under public comment. Just want to make sure. Okay, so we're going to move on then. Maya, where are you? She just stepped out. I'm going to skip item 4 for just a minute because, Gary, I have a note that we wanted to defer item 4 to the next meeting because one of the South County presenters is not here. Is that accurate? I literally have 2 notes here that say conflicting things. So.
The majority of the item could be heard today. The part that we would like to defer and agendize for the next meeting is a report on the pilot program with Gilroy PD and Gilroy Fire on the diversion of 5150s. Dr. Miller is unfortunately in Washington, D.C. tonight and couldn't be here to make the report as part of Tony's report. So I think if we went ahead with 4 on Tony's part and then scheduled the other one for the next meeting, it would be great.
So may I ask then your thoughts on this item, which is that it appears to me that, oh, well, never mind. Let's go ahead and go start with 4. All right, Tony? Great.
Can you hear me now? That sounds like you can hear me. Okay, that's much better. So, Chief, now we have a microphone. So we were asked to describe the kinds of services that we have in the South County related to behavioral health, and what's included in the report are the services that our department currently provides, as well as an update on what's going on with the Reentry Center. I can hit some highlights, and then I'd be happy to answer any questions that anybody on the panel has. And we can start with what's going on overall. I will say that in our South County area, we have been increasing the number of services there, both for criminal justice clients as well as for our adult and older adult clients. And I think from the county recovery center that has opened in the Gilroy location, this is there is a chart that you'll see on page 4. We've seen an increase in the intakes in South County. There are a number of services that are being provided there at the RRC, serving the population in South County. We're seeing that the big request for services has to do with the faith-based programs, and our faith-based programs have been many clients across Santa Clara County have been using those services. We note that in South County there is a need for housing. We also know that there's a need in that area for transitional housing units. And the population in South County is growing, and as a result of that, we have an increasing population in that area. What I'd like to talk about are our services, and there's quite a detailed chart here. What we've done in response to your question, Supervisor Chavez, is we've really provided detailed information on all of the criminal justice services as well as the adult and older adult services that serve the population. And I think what's important to say to the members of the Reentry Network as well as the members of the public is that we look at these services in two different ways. One, we're building out a very significant, substantial redesign of adult and older adult services. And our intent with those services is that we can both reach out and engage people through our new engagement teams and connect them to community-based services at a very high level with the intent that we could prevent people and divert people from going into jail. Those services currently are not in place. We'll be beginning the RFPs in the early fall. But fundamentally in our department, we're looking at jail diversion and reentry in two different ways. One, what can we put in place in the community to prevent people from winding up in custody? And two, what kind of services do we need for individuals that are post-custody? So we have a primary provider who's sitting on the panel here. Community Solutions is the main provider that we have in South County. We've expanded a number of their services, and we estimate right now that they're just about at capacity, and we'll probably need additional capacity between now and when we start RFPing for new services. There's a high demand for our full service partnerships, which are more intensive services, and our intensive outpatient treatment. The other thing that we're seeing is that we need more people in crisis residential, and while we have those services in South County, also provided by Community Solutions, our new Muriel Wright Center will have additional beds available for people in the South and Mid-County. Do you want me to walk through each one of these services? What would you like, Supervisor Chavez?
No, thank you. Unless folks here feel like that would be particularly helpful. No? And so I think people saw the report. The only thing I was just going to suggest is that maybe we'll just go to questions right now, and then what I'd like to do is wrap further questions into the next section when you look at the adult adult system.
Okay,
Any comments or questions on South County? Judge Manley?
Tony, I have a general question that does relate to South County. And in your redesign, are you looking at the issue of retention in treatment? Because this is of great concern to me. One of the driving factors, in my view, of our jail population of mentally ill offenders repeatedly being back in jail is the failure to retain them in treatment. And to me, that is as important as creating more treatment capacity. And for example, the FSP program, which is a wonderful program, works with offenders with very severe mental illness, who have been hospitalized, who have been institutionalized, been in and out of jails, yet they have a very difficult time, not because they're not great programs, but because I think retention is a real issue for everyone. So I would like to hope that Supervisor Chavez would ask for a report back on retention in treatment and what studies you've done, what plans you have for the future. Thank you.
Can I respond to that to you? So one of the most important things that we'll be launching right out the gate, most likely in September, are in-home outreach teams that are designed to engage those people that are difficult to engage. We'll have a county team and we'll be procuring county CBO teams all over the county. And our design is really focused on how do we connect people who've been very difficult to connect, who may be in and out of services. How do we meet them wherever they are, talk to families, talk to friends, and really try to get them connected to the appropriate services. Quite honestly, right now, our system has some outreach efforts, but not the kind of extensive efforts we need, particularly for the population that we serve and the population you know so well, Judge Manley. We do look at retention on our clients, and we can certainly provide that. I think what you would see with this particular population, and I don't have the data in front of me, is it can be particularly challenging for people who've been in and out of jail and custody to really stick with services. So the idea of having an outreach team, having a broader array, a broader continuum of care at many different levels, where we're not going to ask people to go from one program to another, but really a continuum of care in one setting, we believe that that will also help. But I can certainly provide information on retention across the board.
Thank you.
Thank you. Any other comments or questions? Erin?
I would be particularly interested for those folks in figuring out why are they going back to jail. So what are the charges? What are the issues? Is it VOPs? What is going on? Because we'll know who's going back, but in terms of being data-driven, I don't know why they're going back. So
And we have, in fact, when Javier, when he comes, you'll be here. When you speak a little bit about the update, we might want to talk a little bit about the research that's already happening in that area. That would be really helpful, because I think you're right that data is going to be king in terms of understanding that. You know, one point I just wanted to make to all of my colleagues who are here is that I know all of you have some part of the public safety and justice system that you're watching or a part of. One thing we know is that over 40% of the people that we have coming out of our criminal justice system are going to South County. And so there are a couple of reasons I think we need to highlight South County. I think one is that unlike San Jose and even the North County, there's a lot less infrastructure out in South County. And I think we sometimes we think a lot about boundaries, right? Counties, cities. I don't think most human beings do. And so when we think about how we're going to really address these kinds of issues and problems, I do think we need to take a deeper look at what our infrastructure support services are out in these areas. And in particular, I'm excited that we have a reentry center and have a family justice center. We're moving in that direction, but we've got a lot of services that are a little bit scattered. And at some point, we may need to have a deeper dive just into South County in terms of all the kinds of services we're providing. One other area, Eddie, that this has come up, or Chief Garcia, that this has come up is that when we were looking at the Mayor's Gang Task Force and the services that we were providing here in San Jose and the lack of services in South County, where we have young people that are, frankly, that are interacting with each other quite a lot, that some of the systemic problems we're seeing may be because we don't have the capacity to be consistent yet with making both services and eyes available and increasing coordination. So as part of the policy subcommittee, one of the things I'm going to ask Angel to take a look at is how investments, particularly in young people, may or may not help us as we're thinking about how to address the increases and decreases that we're seeing in both criminal activity but also readmission into these systems. So, all right, so we're going to move from that item. If there are no other comments or questions, thank you, Tony. And then we'll see the second part of this, Gary, at our next meeting. and so apologize for miscommunication there. So if we move on to item 5, and this is to receive a report from the Office of the Sheriff relating to programming and services for women and framework for gender needs assessment of the Santa Clara County Correctional Facilities.
And I'd like to introduce Melanie Jimenez Perez and Lieutenant Tom Duran to present.
Great. And if I could just ask everybody to be kind of loud in these mics. Whenever I'm in this room, I always feel like I need to get my hearing checked, and it's not just to make me feel better. Everybody just talk louder. So I need to get my hearing checked. Welcome.
Good afternoon. Melanie Jimenez Perez from the Sheriff's Office, and we have just a very brief report for you today. But we wanted to come to this group to kind of start talking to you about our efforts, because we're really at the beginning stages of our gender needs assessment, but also kind of wanted to bring you up to date on some of the efforts that have gone to make our environment more gender responsive. So first off, I have to thank the probation department. They helped us with developing a gender responsiveness training. It's a 2-hour training that we were able to offer. We started with our academy, and then we worked with our classification staff, and within 6 months, we were able to roll it out to all of our correctional staff. So thank you for helping us. We were able to get that done quickly. And other than that, we have also implemented a new behavior-based classification system, and we really started with the women with our classification system. We started with making sure that the tool worked for women. We did make some changes to it based on what we were seeing with the female population, and we have rolled that out. Now that we've been watching it, we've been monitoring it, we saw that we still need to create some additional flexibility within our inmate population to increase our out-of-cell time. So we have started a pilot with our women's population of just grouping them into low, medium, and high. We've found that that has made it easier to bring inmates out of their cells. It's also put a lot of time on the classification staff to revisit some of the old keep-aways that some of the females may have had in their files, and that has been extremely successful. So now that it's worked with the female population, we're going to roll it out to the males, starting with Elmwood in the coming months. As for programming, that was one of the requests also in the ledge file. We have been looking for opportunities to expand our programming. We have hired a programs manager who will be starting in July, so we're hoping that with the new programs manager, we'll be able to continue to expand. But one of the things that we also had was the board passed a no-cost MOU just a couple weeks ago for Five Keys Charter School. So this is bringing a high school into the correctional facilities for the first time. We are extremely excited. This has been a large undertaking for the Sheriff's Office, and we're grateful to have Five Keys on board. They will be partnering with Work to Future and with NOVA so that we are using kind of what the industry trends are to guide what our vocational programming will be in custody. So we haven't made a final determination on what vocational offerings we'll have for the females or the males. We're going to start with inmate surveys in the month of July, kind of to see where their educational needs are, what jobs they're interested in, but also coupling that with some of the labor unions. Where do they have spots in the pre-apprenticeship programs so that we can place people as soon as they are released? So that's it on programming. As for the gender needs assessment, we really have looked to the model that the Juvenile Justice Systems Collaborative has used at doing a gender needs assessment. And we want to bring in an expert to look at from our booking process all the way to release and reentry to make sure that we're using our gender responsiveness training in the way that we're structuring even our discharge planning. So that is something that's in the works. We did apply for funding with the budget process. Didn't quite come through, but we're going to look in the fall as to how we can continue to move that initiative forward and work with procurement to get that done.
So can I just stop you for a minute? Because I think what happened during budget was that the sheriff made a comment or a statement that you would be funding that out of Object 2, and I was hoping that we were not going to be waiting till the fall. I thought we had somebody. I don't think there are that many people in the world who do this. I thought we had somebody to sole source with, but that's not the case?
No, we don't have a sole source. We do have to go through the full procurement process.
Because there are multiple experts in this field?
Yes, we're going to
and
work
we've
with
identified
procurement
them?
to see how quickly we can get it done. We have done some research to identify some of the experts out there, but we're going to work with procurement to make sure we follow the right processes to see if we can do a sole source. I doubt it, though, because there are many experts out there who look at gender needs.
So to be perfectly kind of candid, so one, we've been having a conversation about this for a while, and I know we've been moving back and forth, and I also just want to acknowledge, Melanie, that the Sheriff's Department has been enormously deferential to the Office of Women's Policy to try to work with someone who wasn't available. My understanding was the reason we were doing that is that there were too few experts in this area, but that's not accurate?
Well, we were initially hoping to work with the Office of Women's Policy to use a specific expert who had experience with the county, but now that we're not trying to utilize that, there are other experts out there. So we would have to see who else would be willing to come in and work with us.
And if I may, we're going to work through the purchasing process as quickly as we can. And if we do have obstacles or there's other ways we'd like to go, we may call on county staff to maybe help smooth the way on the purchasing process. But we did make the commitment, though, even though it wasn't funded in this budget, that we thought it was so important that we would fund it out of our existing money.
So one request, and I'll just make this of the county exec's office through Miguel, is that it seems to me that one opportunity maybe instead of doing an RFP would be doing a request for qualifications, because I think in some respects the point you raised, Melanie, that we had somebody who had experience with the county, which is why we were interested in working with them, and frankly, a lot of the work that's been done here has really been more at a prison system level. There are very few counties that are kind of endeavoring on what we're endeavoring, so in some ways we're kind of creating a path. But that may be a reason to use a request for qualifications, giving you the flexibility to do an assessment of who you think would be a good fit. And so I would just ask if through Miguel, through your team, if we can really work with procurement to give the staff flexibility. And also RFQs are faster, right? Because we're really able to help them help us shape what we need.
Yeah, and thanks to your office, too, I think we've done a good job of kind of stating what we need. So it's now working with procurement to get it done as quickly as possible. And we will be including this in all of our quarterly updates to the board on jail reform efforts, just so as things develop and we get a better sense of a timeline, we can make sure we share that.
Thank you. And then, Sheriff, I'm not sure if this is for you or for Troy, because I know you've both been doing a lot of work on this, but so two things. One, I want to just acknowledge the really important work done on classification. Thank you. That's not easy, and we had to be careful for a lot of, I think some folks were nervous that it was taking so long, but we also have an obligation to make sure that everybody who not just works in the jail, but inmates are safe. So appreciate that you were doing that in a safe, thoughtful way.
And Lieutenant Duran deserves a lot of credit for pushing through that process and working on it.
And I know that was new, so I want to just acknowledge that. And also, I don't know if they're here, but actually, Christine, I think the first meeting I ever had with you, Christine, you were saying, we want to address that classification process. So, yeah, and so well done to everybody. I know we're moving in a good direction. And I know that you all have been thinking a lot about programming, too. And I want to just ask if the survey that you're doing on interest relative to 5 keys, I just would want us to be able to try to do two things. One is, where necessary, I want to make sure that we can do an educational assessment for people who are interested in getting it. I know they can be expensive, but I think they're enormously important. And one of the other issues we're going to talk about later on the agenda around fetal alcohol syndrome is part of the reason I think we need to really do a better job of actually doing educational assessments for people in addition to what their interests are. But on the survey, I am really interested in seeing with what kind of specificity people ask about particular types of jobs and particular types of therapies that people are interested in. Because as I've gone out to the jails over time, it's interesting that the population, the people that we're housing, how they've responded to issues relative to everything from meditation to, I know there's been a desire on behalf of some of the inmates that they want to be able to learn cooking, and that some of our women's advocates were offended that we were only looking at cooking, and I think we have to be listening to the people that are in our custody. So I don't want us to preclude or prejudge. And actually, Troy, you had a great idea around physical fitness too, about hiring PE teachers, which for some of the women we talked to, that was like exciting to them. So anyway, so I as we do those surveys, I want to really make sure we're listening to them and we're not overlaying our own biases on what people need. Do you have worries or concerns about that or thoughts?
We really don't, because that's who we need to look at. I would like to have programs for women inmates that are not necessarily traditional women type jobs, but sometimes that is sometimes what they're expressing. At one point they were talking about cosmetology, and then someone said, well, we need to listen more to what the inmates want than what we think they should have.
And Supervisor, just to add, so that is also why we wanted to start the 5 Keys contract in July. So we've already worked on getting them, we're working on their clearance, and so they'll be spending time with the inmates to conduct those educational assessments. And instead of having them fill out a survey, having the dialogue about which jobs are you interested in, and then we won't start the school year until about the middle of August when traditional school starts. So they're going to have a lot of kind of time to circle back with some of the groups, and they've already been in the facilities and done some initial surveys. So you're right on the money. Those are some of the issues that we have them looking at specifically.
And if you could just forward to the committee just what the educational assessment is. Thank you. That would be great. Pablo?
So I just wanted to kind of just put it out there. I know you guys are doing a great job. Classification has been one of the things that I always ask about as well. When we're looking at doing those surveys, if we could really ask the direct questions. The majority of the people that are in custody, they know about the programs that are there, and they know the effectiveness. They know the level of what can be better, and they're really, really understanding of what they need. If we put it in a way of if you could have any program, or what program do you think would be the most effective, I think you're going to get some real honest answers, and ask about like how they should be implemented, not just the program, how it's going to come, but how it's going to, the actual service of it is going to be implemented, so that you get that perspective of delivering that service, of how the people that are going to receive it need to have it kind of shaped and put out for them. If we do it that way, I think you're going to have a lot more success.
That's an excellent point, Pablo. Okay, on this item, we have one. Oh, you know what, Scott? I missed you on the last item. Where is Scott? I missed you on the last item. Do you want to speak on this item because I missed you on the last item, or you?
You know, on the other one I filled out for the next item, I
Oh,
kind of combined.
okay, great. Thank you. Sorry about that. All right. So any other comments on this? Yes, Cora. Cora, can you turn on your mic?
I just wanted to comment on the timeline that you set for yourself, and that was really great. Thank you for doing that. The other thing is I wanted to talk about the needs assessment and the surveys that we're talking about. To Chief Laurie's point, that sometimes we do a lot of surveys and we're not really ready to look at the non-traditional needs when it's expressed to us. So I think we should be very careful about saying, okay, what do you need, if we're not ready to provide it to them, correct? Thank you, Chair.
Great. Thank you for that. Any other comments on this item? No? Okay, then we're going to move on to receiving the report from the Office of Reentry Services relating to the status of the Updating the Adult Reentry Strategic Plan.
Good afternoon, Javier Aguirre, Office of Reentry Services, and with me is Nellie Lee with Office of Reentry Services as well. Just wanted to make a point to the Commissioner Tamaulinas about the surveys. And so 2 years ago, working with the Office of the Sheriff, we did a survey about education, and one of the things that inmates were asking about something different than high school classes, and so they were asking for college classes. And in partnership with the Sheriff's Office, we use AB 109 funding to work with San Jose State University. and now they provide college courses there at Elmwood. And it's been one of our successful programs, 2 classes per semester, 1 for men and 1 for women, and the board just approved the extension for next year. So it is doing the survey and then doing the follow-through is critical to gain all of our clients' trust. So with this report is just to give you an update on the adult strategic plan. And what we decided to do is just give you a kind of a very succinct, concise document that kind of lays out what we've been up to. So the Office of Reentry Services continues to collaborate with our partners to produce innovative ideas and then as well identify the challenges and successes. And that is going to help us to guide the strategy for the next 3 to 5 years. As you recall, last year we brought in DC Design, a social impact design firm, to facilitate the Reentry Network's meetings. And now they've been facilitating 4 key working groups. They've been doing some facilitation with clients and staff to gain input. And so, and then along with what DC Design has been doing with facilitation, we've been also doing some research with other counties like San Francisco, Alameda, San Diego, San Joaquin, Santa Cruz, and our staff have visited San Diego with probation, then with Alameda and San Francisco and Santa Cruz, and then we participated in a National Reentry Center webinar about other counties' efforts. And then for the gender responsive work, we've been receiving ongoing training from the National Institute of Corrections along with the Office of the Sheriff and probation. And then lastly, we also been working with the County Executive's Office and probation on kind of looking at the findings of the Results First initiative, something that the board just approved the report on June 19th, and that's going to also guide us in terms of evaluation and looking at best practices. And with all that information, we are focusing on gaps in services. And so if you look at the second page, on the back page, the gaps in services, what's been identified not only by the staff, but by our CBOs and our clients. And that is individualized and cohesive case planning, of course, secure housing, employment and income generation, transportation service navigation. And I just want to highlight one thing about service navigation, and that's, so what do we mean about service navigation? And what a lot of our clients and staff have identified that is having clients linked with community workers and peer mentors. And so it's critical for an individual to work through the county system to identify how can they succeed when they come out of jail. And we always keep in mind that while they're in jail, they're told what time to wake up, all the services are provided, and so when they come out in the community, they have to navigate the county system. So imagine trying to figure out where to get public benefits, where to go and get primary health care, employment, education. And so through peer mentors and community workers, that's a way to navigate. And so we've acknowledged that peer mentors with lived experience, and I want to emphasize that lived experience, having people knowing the system, how they worked in custody and also when they come out, having and hiring folks with lived experience has been instrumental in terms of the success of our clients. And then last year we asked our employee service agency to kind of look at the various job codes that support our clients, from peer mentors, at probation, at behavioral health, community workers. Now our office now has 2 community workers, along with community health workers with ambulatory care, and then social services have peer specialists, public health have peer specialists. So there's so many job codes that help navigate client services, and ESA is going to be taking a look at how do we redesign or come with more simple job codes to fulfill that gap. And then our partnership with San Jose City College, in terms of, I always say the county is the largest employer, over 20,000 employees, and we're trying to figure out where to employ our clients. Well, one way of entry level through the county is through peer mentors and community workers. So with San Jose City College, we have this course that's offered at the Reentry Center, and so we're trying to then hire folks that graduate from that program as extra help or encourage them to apply to county jobs. So education has been a interest for many stakeholders. So I'm thrilled as well that the Office of the Sheriff has this no-cost MOU with Five Keys Charter School, and they highlighted that if it goes well in custody at Alameda Main Jail, we may be able to look at providing Five Keys Charter School as another opportunity for them to provide that program at the Reentry Center. So there's a continuation from folks that are at Alameda Main Jail to continue that at the Reentry Center. And then I'm very happy that our South Bay Consortium of Community Colleges is now represented here, because we got to start looking at the new job trainings and new career development opportunities to expand to our clients. So with that background, our next steps. So in July, DC Design will meet with our office at the center to review the initial findings and then to establish draft recommendations and create a roadmap of a client's path from custody to reentry. In August, we'll reconvene all the 4 working groups, and all the members have been part of this journey in terms of gathering input to review the findings, and then we will plan to establishing a programming plan that will guide us to release a request for proposals in late 2018. Keep in mind that our services will end July 1st of next year, so we're going to do a huge RFP to do both the in-custody and the services that we provide at the Reentry Center in the community. There was a mention about data, and so as a matter of fact, tomorrow we have a meeting with the Sheriff's Office to pull arrests and convictions of all of our AB 109 clients, and also to target those that are coming to the Reentry Center to see why they're being rearrested and convicted, and how we could pinpoint programming that could perhaps reduce recidivism. In August, we will hopefully provide a verbal report to this committee on the progress of the strategic plan. And then in October, we're hoping to provide our final recommendations as an update to the reentry strategic plan. So with that, that's our update on what we've been doing with the reentry strategic planning efforts.
Great, thank you. Any thoughts, comments, or feedback from the committee? We have one public speaker. Oh, I'm sorry, Judge Manley, go ahead.
No, Javier, when you submit your report, I noticed, and I think it's very thoughtful to do this, that you put down the possible barriers. Are you going to address each one of those in your report?
That is our goal. Those are the key barriers that have been highlighted by staff and our clients, and so we've been very diligent in doing surveys in our center, and then also kind of looking at what our CBOs are telling us about the clients that they help us navigate.
Excellent. One other quick question. I strongly believe in the peer mentor navigation program that you're developing and all these different job codes. I observe that all the time. What I'd like to know, do you know what the caseload is on average for the individuals now employed doing this work? Have you surveyed that at all?
So we are working with the county's efforts on whole person care to kind of look at all the different caseload. So it varies depending on the level of need. So like our faith-based center, their peer mentors by 25 each of the peer
25.
mentors. Perhaps those that are part of like a mental health program, they may have fewer. Our parolee program has about 20 as well per peer mentor. So it varies from different sectors.
Okay.
But that's something that we will.
But you'll report back. Thank you.
Absolutely.
Anybody else? So I have a request, and maybe this is a question that Tony, I just want to catch your attention on. I am interested in understanding how the redesign of the adult mental health services programming dovetails or doesn't into the reentry center. And then, because I think that, so that's important, and let me stop there and make that as a concrete kind of connection, coupled with how we continue to address work that we're doing with the homeless population, because I just want to make a couple of points that I'm concerned about, and one of them is that having reentry centers near navigation centers for housing, which is, we have some, I'm not suggesting we're doing that now, but there's a big push for us to create a navigation center for housing and then how we're addressing people who are mentally ill and homeless that are on the street, whether, you know, we're using now the reentry center to be able to use the sobriety center, which makes sense that we would start to co-locate services, because what I'm nervous about is, not nervous is a wrong word, but it feels to me duplicative and wasteful and not sustainable to have centers that are affixed to just one or two needs of the population versus creating really seamless places that people can get help. So, and I understand as it relates to the reentry center that when we very first began this effort, almost all of the funding came from the state and a very specific pot of funding. But since we're really trying to leverage resources across the board, I think it's going to be really important that we concretely address whether or not there are reasons to have very discrete centers or discrete places that people can get a specific kind of help for some very specific reason. I think between the rents we're paying on multiple facilities, and again, I'm just thinking about South County because I was there this morning, in some instances it would make much more sense for us to have one location for people to have access, and or if we have multiple locations, it's because they are along a very particular high transit route or something that's above and beyond this was available, and we're going to put some services in it. So I don't know if and I'm just saying this to all the staff because I think as we become specialized, like for example, the number one issue that pops up in all the places we're providing services is housing. And I don't, Key can't have a staff in every single facility. That would be crazy and not a good use of resources. As an example, the second thing is look at mental health and drug and alcohol addiction are core components of what we're dealing with in the jail, what we're dealing in the reentry center, even in the family. In some of our other, I'm trying to remember the name of the family resource centers or family health centers or whatever. It just feels, I'm nervous that we're not leveraging resources. And when budgets get tight again, and I know that's hard for everybody to remember, we're going to be scrambling to figure out how to save these services. And if we don't build sustainability in sort of at the base level, we're not going to be able to do that. So in any case, I would like that when it comes back to better understand how this is being integrated with other services that we're providing. Please.
Could we come back to the next meeting with sort of a mapping out of what we're putting in place? Because I think it would respond to those questions. And we're thoughtful in behavioral health in the same way that you are. Where are people going to go? How do we create a more seamless opportunity for people to get connected to services? What does it mean in different parts of the county? And a lot of the work that we're doing across the system is focused on this effort. So we could bring some maps and talk about that. I'm not prepared to do that today, but I'd love to.
Yeah, and I think I think it would be good to have a conversation, and this is another issue I was talking to Chief Garcia about, and I know Raul is taking a look at this relative to homelessness, that how, in some ways the people who are interacting with the highest need population, I'm thinking about police officers in particular, that they're kind of the catchment, for lack of a better word, for lots of different kinds of needs, and we're trying not to have people drop folks off at the jail. So then where? And do we go to one place for this group, another place for that group? And at some level, we can only train one person to do so many things. And I'm worried. And I'm also nervous because I know the sheriff's department. I don't know so much about San Jose, and I don't know as much about Santa Clara, but I also recognize that for almost every public safety job we have, we're screening 500 candidates to get to one. So it's not like we're going to hire a whole bunch of those folks. And so I think your point about peer mentoring and other strategy you have with paraprofessionals make a ton of sense, but they only make sense if we can figure out a way to not have 20 systems deal with one family, longer term.
If I may add two things. One is, so with Tony's leadership, now at the Reentry Resource Center, we have an outpatient program, a substance use drug outpatient program, which is part of the parolee program and also part of our just reentry clients. So now we'll be receiving Medi-Cal reimbursement for that, so we're going to increase capacity. What is really great about having an outpatient program at the Reentry Center is with probation. So probation and also pretrial officers, they want to know that when they report to the center for outpatient, they could also do a check-in with the probation officer. Key, Lee, and I have been working with Police Chiefs Swing and Smithy and for Morgan Hill and Gilroy about using the reentry center in South County for a place where police officers can drop individuals knowing that they're homeless, because we now will have case managers and staff there from Office of Supportive Housing. And the second point is the cross-training. As long as a lot of folks can do what housing calls a VSPDAT in terms of putting people into the housing queue, it is critical. So most of all my office staff knows how to do VSPDAT. A lot of behavioral health, like the faith-based, does a VSPDAT. So even though Office of Supportive Housing will have staff at some centers, it's getting people screened and into the system.
Good. So
I'll just comment that, where's Chief Garnett? That we're working really closely with probation as well as reentry, really trying to connect all of the dots. And also when we talk about peer navigators, I think one of the things that's going to be really important is that we identify where are these peer navigators housed, who are they working for? Because my concern, quite honestly, is we're exploding with peer navigators, but we haven't really created a system. So part of the work that we're doing right now is to bring someone in with a lot of expertise. We've got Mary here, but consumer-led peer navigator, peer mentor training, there's a distinction there. And I think one of the behavioral health requests is going to be bringing everybody together that's using this kind of service and really lining up who's on first. And that's actually our biggest concern right now.
Yeah, I don't disagree. And I know that I can hear Aaron's eyes rolling when I say what I'm about to say, which is I feel that way about case management already. And having case managers and no place to send people for services is, to me, not building out the system in the way it needs to be built. So that's a good point. Scott, I'm going to call you up right now before I mess this up again. Welcome, and I apologize for missing you.
Hi, thank you, everyone. It was originally, I believe, item 4 was the one I was going to comment on, but I can kind of loop them together and make it quick. I guess what was frustrating, we had a health and hospitals meeting, and there was a physician that was up on the panel, and he was talking about people that still call to get drug treatment, and mental health services still are on a waiting list. So the same list that I got on 2.5 years ago and begged and begged and begged to get any type of help, people still have to wait. So I am very frustrated with that. If we have people that decide to do the right thing, throw in the towel and tap out and say, hey, I'm done with this, why can't we help them right away? Why do they have to get on this list? I went through that list process probably one time they allowed me a bed, and my mom and my ex couldn't find me, but all the other times it was absolutely frustrating. You're begging on these phones, you're leaving messages. I didn't have a cell phone. Then I'm trying to use a pay phone, trying to ask this person to use things. As my brain was like cottage cheese from doing methamphetamine. So I'm just frustrated. I advocate for people I can't even really interact with and talk to. I have to stay away from meth heads. But I see them when I get on the bus at my grandmother's house in Santa Clara, right when I go over into San Jose, and I take that bus all the way down here. They're everywhere. And the people that I knew living near Garden City, these people did not have criminal records, okay? They were all strung out on methamphetamines, and they're not the people you guys are catching with the net when they're going through our criminal justice system. Go by Garden City over there. It's and it's not just push it all off onto the city of San Jose. The 13 cities dump all their mentally ill and homeless and drug addicts into the city of San Jose, and it just becomes a mess. I'm right over near Garden City. I drive over there with my grandma, and it's just not changing. When do we get county vehicles? When do people go out there and start pulling these people out in a way? They're all going to die, and I watch them every day like that. They're not going to get caught in your net here. They're not. It's kind of scary, so thank you.
Thank you, Scott. So any other comments on that item? Seeing none, I'm going to then move to, let me see, what am I on? Am I on item 7? Receive report from the Office of Supportive Housing relating to the county's partnership with the Council on State Governments Justice Center.
Good afternoon, everybody. Key Lee, Director of the county's Office of Supportive Housing. As you know, the improving the services and outcomes for individuals with a mental illness who are or who have had involvement with the public safety system is a big challenge, a big component for the reentry network. And for those of you who have been doing this work, and for those of you who have been conscientiously advocating for improvements, I know that progress can seem not forthcoming, and even if it does come, it comes much too slowly. Of course, Santa Clara County is not alone in this. Jurisdictions statewide and nationwide are struggling with these issues. But you might be surprised to learn that we have some best practices that we could share with them to improve their services, and we have some, they have some lessons for us to learn as well. So to that end, under the Stepping Up initiative, we've partnered with the Council of State Governments Justice Center to conduct a case study and prepare a report that could highlight our successes and areas for improvement. This report will be used to assist our local work and to assist other jurisdictions. In March, we sent a letter to the membership, the Reentry Network committee members, but today Deanna Adams from the Justice Center is here, and she's going to just spend a few minutes describing the goals, next steps, and then answer any questions that you might have. Thank you.
Hi, thank you all for having me. My name is Deanna Adams. I'm a senior policy analyst with the Council of State Governments Justice Center. As Director Lee has mentioned, you may know of the Justice Center for our work under the Stepping Up initiative, which is a national initiative to reduce the number of people with mental illnesses in jails. Through our work in working with counties across California as well as across the country, we are hearing more and more that counties want to know best practices and innovations that are happening to connect people who are either being diverted from jail or who are leaving jail to permanent supportive housing, and including permanent supportive housing within the continuum of care. Through our work with Santa Clara on a number of projects in the past, including having a team attend the National Stepping Up Summit in 2016, as well as speaking during that summit, and speaking at the Stepping Up California Summit in 2017, we were interested in knowing more about what Santa Clara is doing. We had the privilege of attending the Council on Criminal Justice and Behavioral Health, formerly the Council on Mentally Ill Offenders, site visit here last year in Santa Clara, at which time we were able to hear Director Lee talk about some of the work that is being done. Through that, we were able to set up conversations to talk more about how the permanent supportive housing program is being incorporated to look at those people who we are focusing on under the Stepping Up initiative. So I'm here today to tell you a bit more about this project, which is going to launch today. So this is the first day of it. It will expand over a 4-month period, at which time we will hope to speak to a number of county stakeholders, as well as go through information sources, and we're working in partnership with Director Lee to see really what the county is doing, so we can highlight those in a written case study that we can add to our resources, both through the Stepping Up initiative as well as through the Council of State Governments Justice Center's National Reentry Resource Center and other resources out there. In conversations with Dr. Lee, there was also interest in looking at areas that could be strengthened, as well as how we can potentially come back at the end of this project to present the findings in whatever way would seem most useful to the county. I know I just gave a lot of information, so I will pause here in case someone has questions. All right. So as far as next steps, as mentioned, this will take place over the next 4 months, and I will be the point person on this project. I will be working alongside my colleague, Hallie Fader-Tal, who joins me with our work here in California, both through the Stepping Up initiative as well as through other work that focuses on the behavioral health needs of people moving through the criminal justice system. We will also be working with our Deputy Director for Housing, Elizabeth Buck, who joins us from the Corporation of Supportive Housing, as well as our Behavioral Health Division Director, Richard Cho, who came to the Justice Center following his work with the U.S. Interagency Council on Homelessness. So we look forward to sharing all the great work that you're doing with the field. Thank you.
Great. Thank you. Any comments or questions? Key, any last thoughts? Thank you very much. We'll look forward to the research. All right, so we're going to move on then to item 8, and this is to receive a report from the Santa Clara Valley Health and Hospital System relating to how disabilities such as fetal alcohol syndrome and autism can affect behavior and consideration of those disabilities for jail diversion.
And am I loud enough up here?
And you can sit in either, you can sit there, or if you'd like to stand, it's up to you.
Who's talking?
I'm sorry, I'm speaking. And Maya can help you.
This is fine. Thanks.
Great.
You know, just a couple things before I launch into the rest of this PowerPoint. You probably all know that Dr. Paul Russell was scheduled to present today. And it is with tremendous sadness and honor that I'm here to carry on what he started. Oddly, there is a kind of closing of the circle here. He presented over the years and closed his presentation with a quote from, turns out, me, something that I wrote 20 years ago. He got my name wrong, but I left it in here because he put it in. This is essentially his PowerPoint. So I may wind up skipping very lightly through some of the slides because as I listen to what you raise, I realize that there's some other things that need more emphasis than brain parts kind of thing. And plus you can read that at your leisure. All right. I also want to say that 20 years ago, we had a diagnostic clinic at Valley Med. Which I had the privilege of directing. Christine was on the team. Other people here were also involved. It was closed because the powers that be at the time really did not feel like this was a real issue, worth the time and money. So, but we're still here, we're back, we are a collective, a collaborative, and we are very happy to help with whatever we can. The other piece I want to say is that what I'm going to do today is just the quickest spark of an introduction to the issue of fetal alcohol damage. It is a puzzling, baffling, cunning, powerful condition, and I will touch on some things that make it that. But because it is so baffling, in order to really get our hands around it and manage it well, let alone prevent it, we have to really sink our teeth into how to recognize it, what are the resources necessary to serve it, and what are the attitude changes essential to cause that all to happen. One of the last little pieces here is I have to say I just got off the phone with a justice guy in Alberta, Canada, who is, Alberta is a little bigger than twice as big population-wise as Santa Clara County. They have in their system, in their Ministry of Justice, a little 3-person position to deal with fetal alcohol because Canada knows that it is very, very important. 20 years ago, Chrétien, Prime Minister, had 2 adopted kids, found out that they were fetal alcohol affected. They were not behaving normally. He then made fetal alcohol public health priority #1 for Canada for the following year. knowing how it shows up so expensively and pervasively in systems of the kind that you're here with. Part of that conversation, they recognize that to put in the supports necessary for a person with fetal alcohol will save $800,000 over the course of that person's lifetime. The other thing they realized was that of all the costs associated with fetal alcohol, and that includes education, child welfare, mental health, substance use, and so on, 40% of those costs are borne by the criminal justice system. Okay? So I think one of the things that I hope that you come away from this little talk with is a sense of just how present is this condition among the people that you serve. Even though you have had nobody, I'm almost sure, come in with a diagnosis of fetal alcohol spectrum disorder of any kind. And that's what we're calling it now. We'll get into that in just a second about why and where does FAS fit into that. I sent two things. One was a PowerPoint and one was a piece of prose. And I wonder if anybody who had a chance to read the prose part. Okay, if you didn't, I will just repeat a little bit of it then. I started out with a quote from a lifer up at High Desert, where I started a mentorship program for people with fetal alcohol in the prison. And the lifers got it instantly. One guy said, I know who you're talking about. This is the guy that goes out, picks a fight on the yard, gets beat up, goes back out the next day, picks a fight with the same guy, gets beat up again, and does it over and over and over. He went on to say, this is a guy that is always being played, and he's always in trouble. Lifers absolutely got it. That's who we're talking about here. These are the frequent flyers. These are the ones who do not take your good advice and make good use of it. And that is because of the way the brains are put together in spite of a normal IQ, by and large. Let's see, before I zip into this, the pieces that I heard that I want to make sure that we get to: homeless, supported housing, and retention. Really big. Okay. Fetal alcohol spectrum disorders is an umbrella term that describes the range of damage often caused by exposure to alcohol during pregnancy. If we had unlimited time, I would throw in all kinds of little details. Since I got halfway into this sentence, I'll throw in the little detail about this. We say often caused by exposure because sometimes you dodge a bullet. And we now know that there are genetic protective factors that make it so that, for example, in fraternal twins, one takes a hit, the other does not. Okay? Plenty of fascinating information, and the research is coming in, mountains of it. All right. People with fetal alcohol spectrum disorders are the ones who generally fail whatever program tries to help but does not understand this condition. And without pretty good and pretty repeated training, it's really hard to understand this condition. Moreover, the condition is often accompanied by really irritating and off-putting characteristics like lying, making promises that you break, sounding like you totally understand and sincerely agreeing to conditions and then breaking them all with really lousy excuses. These are irritating, off-putting. They get people discharged from programs and they drop out and go back to this roiling sea of homeless people that are shifting in and out of your programs. Okay, I'm not going to read this. Suffice to say that American Bar Association a few years ago really recognized how important this is, wrote this resolution, and the IOM report 12 years ago, of all the substances of abuse, alcohol produces by far the most serious neurobehavioral effect in the fetus. Okay. prevalence. Recent Journal of American Medical Association. The headline of that, promoted by the CDC, is saying up to 5% of us are on the fetal alcohol spectrum. Now again, remember, nobody's coming into your system with that diagnosis, so you're not catching it. But the author of it, Phil May, insists that the midpoint of the range, 6.7%, is where we are on that spectrum. Okay, I just got the note that I have 5 minutes to go, so we're gonna zip through this a little bit faster here. Okay, FAS, that's the part that is visible. You have the facial features, little eyes, thin upper lip, flat philtrum. Fetal, that's a tiny, tiny percentage of people with fetal alcohol damage. Most people have normal IQs, they look totally normal, they sound totally normal, but their behavior and their thinking and their reactions are such that they just do not do well in life. So they are circling back through all of your systems and right down into an early death. The age of 34 is said to be the average age at which people with fetal alcohol damage die. Alrighty. I am thinking that I'm going to just give up on doing the entire PowerPoint here. That's what the syndrome looks like. These are the mechanisms that will happen when you have prenatal alcohol. Just trying to think exactly the best way to come to an end here. The main problem, that you can break this down 6 ways from Sunday. You can test it. Normal testing does not yield fetal alcohol diagnosis because what's really going wrong in the brain is executive functioning. Executive functioning is that collection of capacities that allow you to make good decisions. Good memory, getting the big picture, what do I do first, what are consequences? The implications, I'm just going to go, because my minutes are ticking away here, I'm just going to go to the bottom line major implications here. That the people who fail through your systems, the ones who may not get themselves to the re-entry center because they just kind of get lost, they're in the middle of a crisis, they can't get themselves there, but even if they do, they get some help, some pieces of paper, some things to fill out. It doesn't happen, or it doesn't happen well. The best intentioned programs, without recognizing the signs of and hopefully having a diagnostic resource available to fully, diagnose it, those systems are going to these are the folks that slip through the cracks. Now, with 6.7% of us in the general population with fetal alcohol, how many of them, and if the main problem is that you're not doing life very well, where do you think they're concentrated? They are not fixing your teeth, right? They're not selling your house. These are people who are in your systems, and they're the ones that most often fail. So, what we are recommending as a group is that we, with this prevalence and the urgency and the picture and the amount of money that we could save by putting supports in place, that we could all sit around a table and really strategize what it would take to fully grasp this issue in this county and support it, with skill and all, and as much resources as can be mustered. Because if we remember that close to $1 million in criminal justice costs can be saved per every person that gets adequate supports, hopefully that will be enough to kick loose some upstream investment. I think, does that say how much? Oh, I have 2 minutes. Oh my God, 2 minutes left. Okay. A couple other, and I'm really hoping that there is.
That's actually not a timer for you.
Oh, it's not?
No, but if you want to wrap up, because I think there will be questions, so just go ahead and wrap up, and we have 2 public speakers, and then I'll go to questions from the
committee. That's great. I think one last piece that I'd like to put in is systems have done really good work switching over to trauma-informed treatment, recognizing the signs, dedicating a lot of resources. Also, dual diagnosis, that was the previous wave of understanding that got a lot of resources. What we have here, people with fetal alcohol, and shorthand is fetal alcohol damage to me, fetal alcohol spectrum disorders, if you want to use all those syllables, but people with fetal alcohol damage are very often come through trauma. Your mom drank enough to give you scrambly brains. You were in a household that by and large was a mess. If you came through the foster care system, chances are good there was some alcohol in there. Science, the hard science about this does not exist. So you have domestic violence, domestic trauma often, and you have fetal alcohol. So you have the trauma, and you came with brain damage, which means that the normal treatments for trauma are not going to stick. They're not going to work. We need to throw both of these into the hopper. And the part about the dual diagnosis, if you have substance use disorders and mental illness, and you are operating much younger, which is sort of the bottom line of fetal alcohol, operating at a much younger age than chronologically, you basically should be getting a triple diagnosis. So if I'm, 25, I've got substance disorder, I've got, depression, and I'm operating like a 9-year-old in spite of my normal IQ, that's an important piece that's been missing, and it should be included in order to design programs and communicate well. Last, this looks like ADHD. ADHD is what gets diagnosed. Okay? ADHD, bipolar, and when you move into adulthood, you got your borderline, plus the ADHD and the bipolar. I'll stop.
Thank you. And thank you for acknowledging Dr. Russell as well. What we're going to do is I'm going to take 2 comments from the public, and then I'll come back to you. So you're welcome to have a seat.
Okay.
And Maya will show you where that is. And Barbara, if you want to come forward, and then followed by Mary. And you each have 2 minutes. And if Mary's still here, if she could come forward as well.
Hi, I'm Barbara Hansen. I am a member of the Fetal Alcohol Spectrum Disorder Collaborative. We are a small but mighty and learned group. Many are parents of children with fetal alcohol. I have a nephew who suffered 5 years in prison in solitary, beating his head against the wall that entire time. If only he had not had that damage. Today, you heard about fetal alcohol spectrum disorder, and in so doing, we fervently hope that you will be moved to act and help staunch this flow from life failure to school failure to prison failure. The Center of Disease Controls tells us that 1 in 20 are affected by fetal alcohol spectrum disorder. We look at detainees in a number of different ways, a whole bunch of different ways, but rarely through the prism of disabilities. And this has allowed many to not even get to the starting gate. We need to do more. We need to know more. Christine Clifford, a mother of a child with FASD and certainly well acquainted with the justice system, is your go-to informant here. She knows everything there is to know. I give special gratitude to you, Supervisor Chavez, who listened, who asked, and then acted. Imagine that, a public official who does that. Thank you very much.
Thank you, Barbara. I would have given you an extra minute, but we're not allowed. Welcome, Mary.
Hi. My name is Mary Bagatellos, and I became involved with the FASD Collaborative because the issue touched our family several years ago when we had some nieces come to live with us. And so we became familiar with, although it was kind of an invisible problem in the systems of care, the kids had previously been in foster care, had multiple diagnoses, as we call it, the alphabet soup. But an FASD type definition and FASD type testing is virtually non-existent. It's sort of like a catch-22, chicken and egg. It has to exist to be recognized, it has to be recognized to exist. And we have run against that wall. As the kids grow older, then the question is, what happens in life? You know, how do you really get people up to speed so that they can support themselves, so that they have good judgment, so that they don't get into trouble or become, you know, fall into a bad situation, such as a criminal problem, which often happens. Just alcohol and drinking is a huge problem just with regular kids, you know, keeping kids off of all that. When you have a kid with impaired abilities, it's really a big problem because that all feels really good. So, you know, first of all, I think the system has to recognize it and become more aware, which I'm very thankful that they are, and very thankful that you guys are doing this. You know, obviously, I think more things will happen down the pike. We were very grateful that Dr. Russell was a strong advocate and was helping us get the ball rolling. Unfortunately, you know, very untimely. And we just hope that this is the beginning of a conversation and being able to build in structures that can really recognize and support this population. Thank you.
Thank you very much. Are there comments or questions? Judge Manley?
Yes. Thank you. I'll try and be brief. I just I just asked our wonderful speaker, and thank you very much for your presentation. I have been concerned about this for many, many years and learned the hard way about this. But one of the things that troubles me is we make this alcohol spectrum disorder, alcohol this. And what we see in the courts, and what I've seen for years, is yes, alcohol's there, but it's methamphetamine. It is PCP. It is the opiates. It is marijuana. And if you look at the studies, as I'm sure you look at them all, this creates this condition. And I think what happens is we get, particularly, you know, myself as a judge, I think about this as only relating to alcohol and not all these other substances, including tobacco. I also say to myself as a judge, there is something I could do every day. I have pregnant women in custody in my courtroom or out of custody. And, you know, this is a chance to intervene. We don't have to have one more baby born, because I'm sure everyone can understand how this is passed on. You didn't do all the scientific detail. But, you know, we can do more about that in terms of working with mothers who are in our system and are expecting babies. And I think, and I mean, I try to do that, but I wish, you know, we were more, in criminal justice, had more knowledge about this as being a widespread problem. I mean, in terms of looking at people who are in our system now, who are the frequent flyers and all the problems, every one of them, when I look at the evaluations, when I look at what the diagnosis, I look at everything, and it all begins with my mother and my father drank, used drugs all the time. It all goes back to that, I mean, so many times. The second thing I would ask about is this second issue. We have fewer filings in juvenile court now than we used to. I mean, in other words, fewer cases are coming into the court in terms of what was once the case. And I think this is a very broad community problem because many people don't enter our system necessarily as juveniles, they can enter as adults. And that we need to have, to me, a lot more education. We ought to be trying to do something about little kids. We should not wait until they're sucked up into our juvenile system, where we do, I think, a wonderful job with probation and the services that are provided. We do a fantastic job in this county, but I worry about all those kids that never get there, and then all those kids of mothers and fathers who have this, and it's not a bad, evil thing, it's a disorder, like mental illness. And we're not really trying to work with them when they are 2 and 3 and 4 and 5 and in preschool, and that worries me. I don't know what the answer is to it, but I sure wish we were doing a better job. Thank you for your work.
Thank you. Yes, yes. Let Maya show you how to turn that on. And then Aaron or Christine, and then Mary.
Thank you so much, Judge Manley, for especially that last part. The part about the little ones at 2 and 3 years old.
Thank you.
Thank you so much for that. If we could even just start with the kids in foster care, because I don't know if the stats have been done on how many of your frequent flyers came out of that foster system, but my guess is a lot. So if we could even do screening and diagnosis and support in the foster system, that would be a huge step ahead. About your first point, you are so right that there are many substances that cause problems. It still remains, though, the research is ever stronger that alcohol, tobacco is looking pretty nasty too, but the other ones are just not doing the damage that alcohol does, and alcohol and tobacco are the ones that are legal, and they are the ones that are the most commonly consumed. So, pushing back on you a little bit on that, but hallelujah to let's bring the system together to adequately recognize kids with these kinds of brain problems and bring in the supports necessary for that.
Thank you. Christine and then Mary.
Thank you, Kathy. I do have 2 adopted children, and my oldest son is a fetal alcohol spectrum guy. I had to take my son Daniel to Seattle to get him appropriately diagnosed because I could not get him diagnosed in Santa Clara County. I couldn't get him diagnosed in California. He does not have any facial features. He has a normal IQ. He's 6'4". You would never pick him out as a fetal alcohol kid. But Daniel learned that it was time to get out of the shower when the hot water ran out. Now, that may sound funny, but these were the life and the day-to-day problems that he continues to face. He's 28. I am his external brain. He's able to work, but he is not able to live independently. So when I encountered the jails and our justice system, and I began to look at the people who can't, who will get up and say, I understand my Miranda rights, or they'll take a deal that's been presented to them and really not understand. They'll nod and say, I understand, but they really don't understand. And they're the people that come before Judge Manley repeatedly who've been given, instructions on what to do next, can do them for a little while and then can't do them anymore. Or they come to Chief Garnett's services and they can do the first maybe 1 or 2 things and then they fall flat on their face and they get rearrested. These are the folks that are, just littering our systems. And I recognize in my son every day those things that could have got him there. And when I look at these behaviors, I always have to remember, is this a can't or a won't? And it's usually a can't. So I'm hoping that we'll start to look at our systems in a way when we encounter people who are just so baffling and frustrating to us that we kind of put on that lens of can't versus won't, because usually it's a can't. And you're dealing with someone who has brain damage, not willful disobedience. So thank you again, Kathy, for being here.
Mary.
Hi, Kathy. It's good to see you.
Hi, Mary.
Even 20 years ago, when we were looking at attention deficit disorder, FAS, and learning disabilities in the criminal justice system, right? In fact, we did some trainings out at the juvenile justice centers, right? So ever since then, as I've been training addiction counselors, I always walk them through what learning disabilities, definitions, what it looks like. Symptoms of head injury, symptoms of fetal alcohol, symptoms of learning disabilities, because it's extremely important when addressing this population to, you were making the point about how much of this has to do with resistance to treatment, right? Willful non-compliance, right? And how much of this is different difficulties with comprehension, learning. What are the estimates used to be 65% people in criminal justice diagnosed with learning disabilities, ADHD, and so when we think about this population, we did back in the 90s, we did a training for all of the behavioral health counselors in Santa Clara County in terms of designing addiction treatment to accommodate the learning challenges of so many of our people who are coming through, because they are criminal justice referred. And there are ways we can do this. I used to do learning disability assessments with every single client that came through, referred from the criminal justice system, so that we could figure out how do we change their treatment planning and design their assignments to accommodate the way they learn. So I'm thrilled to see you. This has been my passion forever, and I always feel like I'm by myself. But this is very real, and it results in reincarceration, treatment failure over and over again. And the problem is, like you said, so many people don't have the face, right? And I love this handout you gave where emotional expression can be, 80%. They sound great, right? But then you try to give them instructions, and it's like it never quite happens, right? And they sort of get thrown into, well, either they're burnout or they did too many drugs, or I don't know. So anyway, fight the good fight, hon. It's good to see you.
Thank you.
Erin, and then Cora.
Just wanted to say thank you, and I do think this is a hugely important issue, and echo kind of what you said. I think that we need to look also more broadly at kind of the neurodevelopment that's not normalized, looking at traumatic brain injury, toxic trauma that impacted neurodevelopment, and FASD, because that is a huge percentage of who we're looking at within the jail system, and what do we need to be doing differently to be able to effectively be supporting them.
I have to say something about that people with fetal alcohol damage are way more likely than the average person to get traumatic brain injuries, because, you're for so many reasons. But again, it's the overlap. People so often ask me, how do you tell the difference between ADHD and fetal alcohol, or traumatic brain injury and fetal alcohol, or et cetera? And so off, or trauma, period, because the symptoms all look so much alike. But in fact, it is the same person. This is a Venn diagram here, right? And it's like almost a complete overlap, because it's the same person acquiring adult adverse childhood experiences, trauma of lots of kinds, including injury to the head and prenatal exposures. So if I've implanted one thing, it's that there aren't separate silos here in terms of problems. There is this issue, prenatal alcohol exposure, with respect to Judge Manley for bringing up other substances, but this is the one that is causal of symptoms of ADHD, symptoms of autism, symptoms of bipolar, symptoms that will get them, driving into a concrete wall because of spatial issues or impulse control issues, so they get the TBI. This is a causal issue.
Thank you. I'm going to go to Cora, and then I'm going to talk about next steps, unless there's anybody else.
Yeah. Thank you also for this report, and thank you for coming to us with that report. I was under the impression that Santa Clara County itself treats people and delivers services with a trauma-informed initiative. So it disturbs me a little that Christine is talking about not being able to have her child diagnosed in this county and in this state, right? It really is kind of disturbing. So in light of the research and in light of your report, maybe it's time we call it out and call it out loud. And maybe it's time that the county took the initiative and the leadership of it. Thank you.
So as a next step, what we're going to do is I'm going to ask Miguel if he will have a meeting with the collaborative and just do a little investigation on just to better understand this issue, and then to better determine in partnership with our departments, A, what we're doing now, and B, what we could be doing. And I just want to highlight 2 areas that we do have an opportunity to be a little more experimental, and one is going to be in our universal childcare pilot program. So for those of you who don't know, the county, under the leadership of Supervisor Yeager, is taking a look at universal early education and childcare, which is really at the root of a lot of what we're talking about here. And a big component of that is doing developmental assessments at a really early, well, all along the spectrum of children's development. And this may be an opportunity for us to better understand if there's a role for the county in this. So I'm going to ask Miguel to take a look at that. And also, just to make all of you aware of this, a number of you sat on a committee that we did a deep dive into our foster care system, and that report will come out in August. It'll go to the Children's Family Seniors Committee and then to the full board. And some of the work there is really going to be focused on what are these early assessment opportunities that we have that, and maybe that we're not taking, and or that we're taking but not diving deep enough into. So this all kind of aligns with other areas that we're going to take a look at it. So we'll ask if Miguel, if you're comfortable with that.
Sure, I'm happy to meet with the collaborative and eventually with departments, and we'll see where we go from there, taking it sort of one step at a time.
Great, and we'll have a report back to reentry. Thank you very much for joining us. All right, yes.
I was just going to say, we have the 0 to 5 Kids Connection Network, and we're very, very involved in detailed assessments at every age, and I think I'm texting staff about it right now.
Good.
But when we look at what's underway, I think there's a lot of really important cutting-edge work underway, where there's great deal of evaluation of these young kids to try to figure out what that path will be for them. So I'd really like to highlight that work and maybe have a presentation by what we're doing, both with the primary care and within our department.
Yeah, and one thing that we might want to take a look at, I think that the child care issue is going to have to go to a subcommittee, and it might be in Health and Hospital right now, but we may need to move it over to Children's Family Seniors Committee, and I'll just leave that maybe to you and John to have a discussion about where that should go, because I think even as the universal preschool program is progressing, that to me, one of the most significant opportunities is really these developmental tests that are more accessible. And also, I'll say part of the reason on an earlier issue we talked about the educational assessments, and why I'm so interested in this relative to the jails is, if you have a child now that needs an educational assessment, often it takes so long to get them in schools that people who have money figure out a way to do them. They're about $4,000 to $5,000 and can take months and months and months to access. And who can do that? You know, certainly not the families, Raul, that many of them that you and I represent. So how we do a better job of integrating in the access points that then give families the best choices and options for providing support to the child is probably very critical, and an opportunity through this program. Dr. Cody?
Yes, I also just wanted to speak to prevention. So education and intervention with moms who are pregnant or of childbearing age to ensure that they are alcohol-free during their pregnancy. Because I think that I'm certainly not an expert in this, but as much as we can prevent or lessen. And so as part of one of the implementation groups for the Children's Health Assessment, there's work on implementing screening for moms. Go ahead.
And one other thing I'll add, Dr. Cody, that I know a number of you are also aware of is that, again, as part of the foster care task force work that's going to come forward, a chunk of that is going to be with this really higher level focus on prevention, in addition to recognizing the role that the public health department plays in that, is really, frankly, expanding that through a number of the initiatives we're working on. Because in some respects, by thinking about it so late, I mean, not that, I understand why we do that, because we're the safety net, but it would be nice to be the pre-safety net in a number of areas. And so one of the things we're going to have to really give some thought to, and I don't mean this just for this committee, but I mean kind of countywide, is what role do we really want to play if our job is to, in a meaningful way, be a safety net, but also to be able to do that with any level of sustainability. That's going to be an issue. So I really appreciate you raising that. Can you be very brief? And the reason is I want to finish. We have one more person that would like to speak, and I have one thing I need people to vote on, which is minor, but I also need to let people go. Yes, Dr. Page.
One short sentence.
standard wisdom in the field of fetal alcohol, the most effective way to prevent the next generation is to take care of the current one
We'll learn more about that.
with fetal alcohol. Yeah.
Thank you. Christine, did you yourself?
Yeah, I just want to briefly add one thing. Having worked in special ed my whole life and worked at the fetal alcohol clinic, standardized testing that looks at, your typical neurodevelopmental things, standard educational testing, standard things that you'll be asked at the regional center if they qualify for services there, standard medical testing don't generally capture this disability well.
Right.
So you have to have another sort of layer of look at. We're not looking for whether they can read and write. We're looking for judgment. You're looking for the ability to connect the dots. That whole executive functioning piece is very hard to capture in regular sort of standardized testing.
I think I'm really glad you raised that, because I don't think that I think A, you're correct. I mean, I completely understand that, and B, part of the reason I think the county needs to play a leadership role in reconsidering how we do developmental testing is because it's not just that, it's autism, it's a number of other issues that we are missing so dramatically. And the more we understand about human brain development, and our ability to integrate those learnings faster is going to be a must. And especially as we're just looking at an explosion of need that we can't possibly respond to absent getting up that food chain. So I'm really glad you made a point of that. Barbara, thank you for your, this woman is persistent. So don't get her on the other side of her on any issue that, especially if it protects other human beings. So thank you very much for your leadership in bringing this to us, and we will get to work. So item 9, if I could just go to item 9, this is our minutes from the last meeting. If I could get a motion to accept.
So moved.
Get a second? Great. A second. Any rigorous debate on commas or other things? No? All right. That passes unanimously. And I want to thank everybody very much. I thought this was a very fruitful meeting, and I would like to just have a quick conversation with Gary and Miguel and Maya. Thank you, everyone. And we'll see you. I forgot when our next August. We'll see you in August. So have a lovely, lovely July. Thank you.